Unfortunately, your results were abnormal. I think we're gonna go for this one here. I see a bigger vein, and this does hurt a little bit. I do apologize. 1, 2, 3. I want you to leave this dressing on for at least an hour and a half, and then you can take it off. All right, Michelle, so we're done with the exam portion of your visit. Thank you for coming, and I know unfortunately your results were abnormal. I am gonna go ahead and have you go over to the lab. We're gonna do some blood tests. I have about 4 vials that I wanna get from you. We really need to test your thyroid and kind of see where your hormone levels are at right now based on the symptoms you're describing and the exam that we did. I'm leaning towards PCOS. Okay. So there will be a couple things I am going to prescribe to you. One will be amoxicillin, and that's the antibiotic because you do have an infection. We'll go over a little more of what's going on with that when I get your lab results, okay? So let's go ahead and move over. I'm going to put you in the lab table. I'll draw your blood, and we can discuss it a little more in detail. Okay. Okay. We're gonna go ahead and get your labs done, okay? I'm gonna roll your sleeve up. Okay, and I'm actually going to have you see if this is a little more comfortable for you. Is that better?
Yes.
Okay. I know having your blood drawn is a little uncomfortable, so I do apologize. So to start off, I'm going to spray your arm with some alcohol, and then I also have some alcohol prep pads here that I'll be using. So this is going to be a little cold, okay? Just let that dry for a second. And while that's drying, I am going to go over the prescription antibiotic I was talking about. So this is amoxicillin. Basically, it's generic for Augmentin, which you might have heard before. What you're going to do is take 1 tablet by mouth every 12 hours, and I want you to take this for 10 days, okay? So these are 125 milligram tablets. Take one in the morning, and then maybe with dinner. I do recommend you take it with food because it can upset some people's stomach. There are further instructions on the bottle if you have any questions. And after the 10 days, if you feel like your infection symptoms are still persisting, I want you to give me a call and we might need to up the dose, okay? Okay. So you'll take those. I do also want you to start taking this cranberry supplement. Essentially, this is going to help with urinary tract health. So the infection is semi-related, but I do think this will overall help with your symptoms. So you're going to take 1 of these a day, okay? Preferably in the morning. Set an alarm for it. Take 1 a day. It won't give you any adverse reaction, but it will kind of help with your symptoms. Okay. And then obviously once we get your lab results, we can go into a little more in depth with prescription medication. I'll probably prescribe you something to balance out your hormones a little better. We can talk about birth control options. A lot of women choose to go on birth control to help with PCOS. It can help regulate your periods a little bit. This is a little more of a natural option. So this is called Inistetol. It does contain folate and vitamin D. Essentially, this is going to help balance out your hormones, support your ovaries. It will help kind of get your cycles back on track and should help your levels normal out a little bit. Like I said, after we get the results, we can talk about it a little more in depth, but I would recommend starting to take this once a day, okay? Okay. Alrighty, so that should be pretty dry. I'm just gonna have a look at your skin. And do they normally have issues getting your blood?
No.
Veins do look pretty visible. I'm not seeing any scarring or discoloration. Okay. I'm gonna go in for a little bit of a brighter light. And just pulling at your skin a little bit. one here. I think we're gonna go for this one here. I see a bigger vein. Okay. Can I have you clench your fist for me? Okay. I think we've got a decent one there, so go ahead and relax. My supplies ready. This is just a Tegaderm. This is going to be what I apply over the gauze after your labs are done. Sterilizing my equipment. I think today we're going to get 4 vials. Okay, Michelle, so we're going to start off by taking 3 cc's. And you're going to feel a little pinch. If it's easier, you can look away. I'll let you know before I stick you, okay? I think that vein there is going to be good. So I'm just going to have you slightly lift up your arm for me. And this does hurt a little bit. I do apologize. Too tight?
No, that's good.
Okay. Alright, so I'm gonna go ahead and small poke here, okay? Okay, so if I could just have you use your other hand, very good. And I'm gonna go ahead and transfer this over to the other vial. Okay. Very good. So we have 1. And that's 2. Okay, so I'm gonna go in with a little bit of a bigger needle here. This one might be just slightly more painful, okay? Be a little poke. Ready? 1, 2, 3. Okay, and I'll just have you hold that for me. Tight pressure there, very good. And we have about 1.5 here, so go ahead and transfer that over. Okay, I'm just gonna dispose of these needles. And let me go ahead and dress that for you. Okay. Not too bad, hopefully.
No, it's fine.
Okay, very good. I want you to leave this dressing on for at least 1.5 hours, and then you can take it off. It is waterproof, so you don't have to worry about it getting wet if for whatever reason you take a shower. I would recommend just using some alcohol to take it off slowly because it's waterproof, it is pretty sticky. I don't want you to pull your skin, okay?
Okay.
And your lab results should be in within the next 14 days. Once they come in, you can either log into your patient portal to access your results, or you can call the office, but I will be giving you a call so we can discuss them, okay?
Okay.
All right, Michelle, well, thank you so much. I'll let you go ahead and get undressed, and I hope you have a very nice day.
Okay, thank you.
You.